Good morning, everybody. I am officially calling this my Tuesday morning rant. This is not medical advice. I do not intend this to be advice on anything medically related as far as drugs and treatments and diagnoses. This is just my opinion as a father, and I guess my platform is I do see patients and I get to hear what they're being told in the medical kind of community, whether that's alternative or allopathic, symptom-based, preventative. I really don't care. My job is to kind of be a sounding board for what people are told, and I'm hoping to be able to speak back some of the things I hear to you guys and help make some sense of it. I am in my baby's nursery today. My Chloe Rose is 6 months old, almost exactly. And I'm pleased that even though she has not been illness-free, she's not had to have medications or vaccinations or anything like that. It's been my opinion to keep her strong, let her body fight things naturally, and take my chances. She's had plenty of colds. She's had stuffy noses, runny noses, tiny bit of coughing, one night even a little bit of croup sound. But my kind of philosophy on that is that we try to do our best to be natural and wait things out. It is normal to be sick as humans. And that takes me to this whole idea of antibiotic use. And lately I have adults and children, all sorts and sizes and shapes and ages, and I hear the same thing over and over and over. Oh, you need antibiotics for this. Oh, you got a bad, oh, you have strep. You need antibiotics. And people, everything plays off fear. So what is strep? Strep is a bacteria. It's a very common bacteria. You get strep everywhere, on the skin, in the skin, underneath the skin, in the body, outside the body. Bugs like warm, moist places. They also like hosts to keep them healthy and happy so they can breed. This whole idea of there's certain things that you need extra help with or else you're going to be in trouble is just... to me, it seems like more of a consumeristic kind of thing. It's more of a getting you as the general public to consume more over-the-counter medications and prescriptive medications. Because for centuries our bodies get sick, we get over being sick, and we develop an immunity. And for some reason people just are not being fed the right information. So I just want to go on a rant for a minute about antibiotic use and how parents and adults are basically told the same thing, that you need this, and it almost positions it that you can't get well naturally. So antibiotics kill bacteria. The problem with that is they kill good bacteria as well. Well, I would say about 100% of the patients that have come in my office with symptoms, anything from headache to joint pain to skin infections, to want to lose weight, to insomnia, digestive problems, and so on and so on, all of them, 100%, have had improper digestion. A little tiny bit of malabsorption. They're just not able to process their food properly because of stress. Stress diverts blood away from the gut and sends it to your muscles for fight or flight. Now, if you do not have stress in your life, this video does not address you. Fight or flight, remember, that's the ability to get out of danger. But in our 21st century, our danger is not a bear or a dinosaur or a saber-toothed cat or whatever stress was, thousands of years ago. Stress now is emotional, structural from posture and injury. It's electromagnetic, it's toxins, it's poor food quality. It's all these things now. It's environmental toxins, pesticides, herbicides, burnt diesel fuel in the air, flame retardants. I mean, the list goes on and on and on and on and on. And no big conspiracy that these things are killing us. I mean, we have a body that's capable of dealing with these stresses. The problem is we need accurate information. So when you take an antibiotic that you really don't need, it is killing the good bacteria in your gut. That bacteria in your gut is basically... That gut is a second brain to you and to your immune system. You're manufacturing neurotransmitters like serotonin, GABA, dopamine, acetylcholine, things like that, neurotransmitters, or at least the precursors to those neurotransmitters that feed your brain. And the brain and the gut use the same neurotransmitters to be well. That's why people with poor guts have poor health and lots of pain and things like that. So my point being isn't drugs are bad. There is a time and a place for drugs and surgery and allopathic and holistic and alternative medicine, all these words we hear. But at the end of the day, you guys are not getting good advice, in my opinion. So my role in your life, hopefully, is to help give you good advice. Whether you need my services or not, please utilize my good advice. And a lot of it, we're just going to sit down and we're going to just go over a few questions, and we're going to apply some common sense that's not based on the stock market or drug prices or herbs from a magic mountain in the Himalayas, or it's going to be based on common sense and what you need. And if you think drugs are best for you, then go for it. If not, just know the body will always appreciate starting with natural means first and then moving towards the more aggressive. But when you're messing around with things like antibiotics, just know when a doctor looks in your ear and it looks infected, there's no way, no matter how much experience they have, to tell whether that's viral or bacterial. If it's viral, antibiotics do nothing for you except make your body more stressed out and sick. And this comes from my pediatrician. He's a great guy. I looked at him and said, "Hey, can you tell the difference?" He says, "Nope." And I said, "Well, how come we don't culture that bacteria?" "Oh, it takes days and days and days and to get the results." And I have people that go to urgent care in 10 minutes they have the results. So if you're going to do antibiotics, at least ask the doctor to do a swab and verify that it is a bacterial invader. So anyway, my point being, my Tuesday morning rant is just about the advice people are giving during cough and cold season. Guess what, guys? People get sick. Try to be as comfortable as possible. It's okay to feel some symptoms. I think the biggest problem for kids is the push to get them back to school and get them back to preschool, and you can't miss school, and the county needs your money and attendance, and there's all these stresses. When your kid's sick, keep them home. Get them nurtured and well, and when no longer are green boogers flying out of their nose and mouths, then send them back to school, or follow the guidelines for infectious disease, because remember, this isn't advice. And for you adults, it is okay to take a day off work. Most people, work will go on without you, and even if it doesn't, you need to take care of your bodies. So I'm not giving you an excuse to not go into work, because remember, this isn't advice, but I'm just telling you, you got to take care of your body. So anyway, I'm done with my rant. I don't know if this made any sense to anybody, but as I was in my baby's room, I just decided to grab my iPad and talk about this whole antibiotic thing and immune system thing, and help you understand that gut health is the key to you being well. If you're not well, maybe your gut's not working. If you want advice on your gut or an evaluation on your gut, I'm happy to do that for you. My consults are free of charge. If you're an existing patient and you already see me a lot and you didn't know, hey, gut health has a lot to do with head colds and flus and that kind of thing, then just bring it up at your next appointment. I'm happy to talk to you about it. Anyhow, Tuesday morning rant is over. Once again, I'm not diagnosing anybody or giving any medical advice. I'm just getting some things off my chest. Have a great day, and I'll hope to see you soon. Like always, you can send me an email for a private response. DrSeanPatterson@gmail.com. DrSeanPatterson@gmail.com. Thanks so much, guys. Bye-bye.